if you are not rehabbing someone back to stronger than they were, you need to reason that as strong as they were wasn't strong enough for them to not get hurt.
Right.
Right. So true rehabilitation has to find a new horizon of strength. Otherwise, you're back to the starting line and starting the clock of when the next injury will occur, because clearly back to where they were is back to the point in which back to the point where they got hurt. Right. So like logically, the rehab process needs to set a horizon far further than the strength of them a second before they got injured. Now, obviously, injuries are contextual, contact versus non. There's a lot of nuances to that conversation, but the fallacy that getting someone back to where they were a second before they got hurt, it's like, okay, well, what about, are we just 1 second away from our next injury then? Right. So
Right. The
that's
trajectory's been set already.
right. And look, I would be, and this is the state of affairs in the rehab space, I would be elated if the industry at large could consistently hit the mark of as strong as they were 1 second prior to them getting injured. But we are so far from that being the mile marker. Like, I think we would be held in much higher regard if we could even achieve that, which I deem to be a relatively stupid goal in the rehab space. Like, if we are not getting that person stronger, then we are 1 second away from injury again. Right. Again, layers, context, nuance, different types of injury, blah, blah, blah. But logically speaking, I think that is a sound position to come from. But the sad state of affairs is that, clinicians and trainers would both benefit from understanding scope of practice. Because look, you talked about LA. The amount of problems LA is capable of solving as a coach. It's like Movement Lab NYC on IG. If I'm gonna fucking make sure I get the handle right, because it's worth people at home going to follow our boy LA. LA
Yeah.
just crushes it. But I don't think there's a person who understands scope of practice better than LA. He is able to solve such complex problems with training. Now, the thing is that as a clinician, you have the scope that LA has, right? And to LA's credit, the scope, the majority of the scope you need to solve very complex problems lies within a PT certification, right?
Yeah.
Like, that is, to me, I would say 95% of the time I'm working with an athlete, I'm working within a scope of a personal trainer.
Yeah.
Period. I don't need to call the chiropractic board. I'm just being a trainer doing training things. But the scope is so broad if you let it. Right. So I made this comparison the other day. We were talking about, I'm not sure if I made it on the podcast because I don't know what of my life is recorded versus not. But when you understand movement as a system, or maybe better yet, when you understand the neuromusculoskeletal system and all that entails, right? From fascia ligaments to tendons, connective tissue, cartilage, and all that. When you understand it, you start to see it as a system very similar to like the endocrine system, right? So the endocrine system, if you were to look at like insulin and blood glucose, and you think about how little insulin it takes, right? Like if you were to look at, IUs per kilogram, and you're like, wow, there's like a little bit of fluid. If I inject this into someone and their blood sugar is high, could save their life. Or the opposite, this little bit of fluid, if their blood sugar is low, if I inject that into them, it could kill them. Training and the neuromusculoskeletal system has as sensitive a reaction to dose and response as something like the endocrine system, right? Now, we might not be dealing with life or death in the acute phases, but long term, these decisions of dosing the right intervention with the right person really add up to some severe consequences. I had this question posed to me the other day about the L3, and it was something I've thought a lot about. Like, hey, is Prescript just about training professionals? It's like, no, Prescript's about becoming a professional. And it's when you deal with people whose, their livelihood is on the line, their family's future, both past and present, are going to be drastically affected by the outcomes of your training. People step up, right? They step up and they like, oh shit, like are we making the right decision? Because every decision in an 8-week combine prep could be the difference between generational wealth or, having to find a job with your communications degree out of a Div 1 school. Like, that's a massive inflection point for an individual and the people around. So it's about becoming a professional, and it's taking the neuromusculoskeletal system as a bodily system as serious as one would take the endocrine system, right? An endocrinologist does not haphazardly approach the prescription of their drug of choice, right? Like, if you miss the mark in the other direction and you give someone, you give someone who's hyperthyroidic a heavy dose of T3 and T4, it's like, well, that could really cause some problems. You give it to someone who's hypothyrotic, and now we're starting to level off and balance the hormone system. And those who may be more akin or attuned to endocrinology, this might be oversimplifying the analogy, but the point is, there's a sensitivity to dose response adaptation to movement that needs to be seen in as high a priority as something like the endocrine system, because the neuromusculoskeletal system and all that entails is equally as sensitive, albeit the ramifications not flatlining someone in the gym. You got to understand the damage done by opportunity costs of stacking up anything other than wins in your profession, right? Like, the amount of changes you can make. It's funny. I had someone the other day talk to me. It was an L3 coach, and they were describing to me, and they actually showed me the video on their phone, a client sending them a video crying because they were finally able to do something without pain. And I was like, man, make a folder in your phone, because that'll be the rest of your life, because you can just save those. I have a folder in my phone. The same thing. Voice notes and videos of people messaging me. I thought I was going to have to get surgery. I already had surgery. I thought I was going to have to get another one. But if you treat the neuromusculoskeletal system with as much respect and deference as someone would treat the endocrine system, you start to stack up W's, and those W's start to become very noticeable, as the sigh of relief of someone who administers insulin when their blood sugar is high, and they can feel all the physiological regulation that comes with the administration of that dose in that particular time. Movement's the exact same way. So it's like,
Yeah.
I guess the takeaway message is, if you don't act like your career matters, it never will.
Yeah. That's absolutely fucking true.
Right? Like, it's just like as simple as that. Right? Some people like
Yeah.
go in, they crack their necks, and they go, they fucking work at the joint or whatever, and
Oh,
they're relatively unfulfilled. And it's like, all right, man, good luck with your real estate exam, you fucking loser. Like, that's where you know what I mean? But like, that's what it is. Where it's like, if you
yeah.
treat it like it matters, then it does. Because of
Yeah.
course.
Yeah, absolutely. And these are impactful changes you can make on people's lives. Like, and to further your point about us not just like training professional athletes, like a lot of my clientele is just people that live life on a day-to-day basis. And I fucking love working with those people because they're the people, and we've had this conversation when I was up there in Toronto. Like, they're the people. I have a 62-year-old woman that she's been a client of mine for like a year now, and she fell this last weekend. Like, it's not a good thing when old people fall, but she like fucked up her knee, fucked up her wrist. She's all bruised up right now. And she texts me and she's like, "Hey, I fell this weekend. I'm not gonna be able to make it in this week, but I just want to thank you because the training that we've been doing is the only reason that I haven't broken a bone or I didn't injure myself worse when I fell." And I'm like, "Yo, that's fucking sick." Like,
I'm not crying,
62.
dog.
Right, right. Yeah, you break a hip at 62, like you're dead before 70, like statistically. Yeah. So it's like it's things like that's why this stuff matters. Is cuz like if you just have this person doing like super basic in between rehab stuff and you're not actually working on progressing them in terms of like physiologically building strength, but also like education on how you can move, the psychology around pain as well. Like that's rehab. It's not just, creating small physical changes. It's creating large changes in terms of physiology, in terms of psychology, in terms of perception and education around movement. Like, that's an all-encompassing view on rehab. Like, this is a 62-year-old woman. I have her doing RDLs and I have her doing Right now, she's doing like unsupported bilaterally loaded lunges. Like, if you can get an older person to do this shit, like that's going to increase their quality of life a lot. Like they're going to live for probably longer because of that. They're going to have a higher quality of life. They're going to be able to do more on a day-to-day basis. Like that's impactful shit. And those are clients that will speak your praises forever. Like talk about building a business. Like one client like that you make a change like that, she's going to tell everyone that she knows that they have to come see you. So it's like there's different degrees of this stuff, but that's what it's being a professional and understanding how to do this and scale it to any stimulus level that's necessary. Because it's dude, it's funny as hell. I tell her all the time, I'm like, yo, when I work with some of these NFL dudes, like we're doing the same shit, like literally some of the same exact progressions. And it's interesting because these guys perform at such a high level, but there's such gaps in some of their, I don't even want to say education, but like proprioceptive awareness around positioning or like movement pattern biases that they have because of the demands of their sport, that there's like these very basic gaps that you can fill. And that's going to increase performance is going to go through the roof with these guys. But like that could just be getting out of bed for someone else. And it's interesting to me to see how like there's the the specific body that you're working with is going to be different, but a lot of times you see these things on repeat. And that's like, dude, when we first started this company, we were a training company, and we started because like we would just fucking commiserate week after week. Like I'm saying the same shit. Everyone that comes in, I'm saying the same shit week over week. So we started to put together like training programs to fix the problems that we would see every fucking day. And that's like when we started to pick up some momentum and like, yo, it's all right. Now it's not the training, it's the education side of this that we need to double down on. And that's I think is a big opportunity for someone that's, you know, you're young, you're in the rehab space, is like focus on education, because that is there's things that are going to take care of symptoms. There's going to be short-term fixes like massage, uh, uh, chiropractic, whatever, even like stretches and exercises. There's going to be things that manage these things long term, which is like probably just a good exercise program and regimen. But then the actual treatment for something like this is educating someone on how they can become self sufficient and they can sort this out on their own the next time that it pops up. Because if they're prone to this happening one time, they're going to be prone to this happening for probably the rest of their life. And that's not the same with all injuries. There's always caveats to these statements, but if someone has an injury that they're prone to get, if they're prone to get low back pain with deadlifting, then fucking teach them how to deadlift. Teach them how they can control their core, or teach them how they can modify that exercise so that they now have 3 different strategies to prevent this from happening in the future. And that's the kind of the check mark when rehab is done. It's not only when you take someone to pre-injury levels of performance, but take them and give them the potential to go past that. But then when you also educate them on how to be self-sufficient so that this doesn't keep happening to them.